Health Check at 11 tonight. A once discredited medical treatment is getting a fresh look to see if it can prevent diabetics from suffering a life-threatening heart problem. Health reporter and registered nurse Allie Gorman joins us with the details on this.
And Jim, we're talking about a high-risk group of patients. For someone who has diabetes and has already suffered a heart problem, they have a much greater risk of having another heart attack, stroke, or cardiac arrest. The government has funded a new clinical trial for this population. It could lead to a new way to treat heart disease, or it could prove the skeptics right.
Great. 3 hours.
58-year-old Lori Entwistle is hoping this infusion, given as part of a clinical trial, will help protect her heart.
I have 17 grandchildren, and I want to be around here for them.
Heart disease runs in her family. Both her grandfathers died of heart attack. Her parents also have heart disease. She suffered her first heart attack at age 47. She also has diabetes, which puts her at an even greater risk for more problems. Dr. Allan Magaziner in Cherry Hill, New Jersey, is now one of several doctors nationwide involved in a trial to see if chelation can help. Chelation means to bind to. The treatment uses an intravenous solution that binds to heavy metals in the blood, such as from industrial pollution. The body then flushes them out. It's only FDA approved to treat lead poisoning, but it's been given for years as an alternative therapy for many other uses, including heart disease.
And the theory is that by ridding the body of these heavy metals, the body will then function much better.
The theory is not proven, but it's getting another look after results of the first TACT trial to assess chelation therapy were published a few years ago.
It was very surprising to everybody once we teased out the data.
The biggest benefit was in heart patients who were also diabetic, a 50% reduction in recurrent heart attacks, a 43% reduction in deaths. The NIH has now funded TACT2, a $37 million double-blind trial to see if TACT1 results can be replicated. But there are still plenty of skeptics, including Dr. Douglas Jacoby, a preventative cardiologist at Penn Medicine. Like many, he doesn't buy into the theory. And as for the first trial,
the issue is that most of us still don't believe the results.
He says there were technical issues, and it's just one trial. He doesn't object to patients enrolling in TACT2, but he emphasizes sticking to things that are proven to reduce risk.
Heart-healthy lifestyle is important. Exercise can lower risk as much as chelation therapy did. Healthy diet is important, and medicines are important.
Like all patients in the trial, Entwistle doesn't know if she's getting chelation or placebo. Patients get one 3-hour-long infusion each week for 40 weeks, along with vitamins.
So if I'm getting the chelation, I believe that it'll help me.
If the results are as effective in the TACT2 trial as compared to TACT1, it could change the scope of how we treat heart disease. I mean, this may be a preventable way of reducing risk of heart disease, stroke, sudden death in millions and millions of Americans.
Now, most experts agree chelation is relatively safe if done as part of a clinical trial. They are still looking for volunteers. You must be at least 50 years old, have diabetes, and suffered a previous heart attack. We have information about the trial on 6abc.com. It's going to take a while to get the results, though. The first trial took 10 years.
I was just going to ask you how long it'll take to get the information.
I mean, at least 6, 7, 8 years before they start to see if it's working or not.
So we'll do a follow-up at that point.
Yes, maybe I'll still be here. I don't know.
Where else? Thank you, Allie. Obama